I know that now there's a lot of people in. I just want to just let you guys know, thank you so much for tuning in and joining Popaholic in this podcast. Mental health has been increasing for a while now, not a while, it's been increasing for years. Suicide prevention is very important. What leads to suicide is often from mental health traumas and issues. So I think this particular topic will be very, very good. Last year, or a year before last year, 2023, I think it was November, uh, we had a podcast on mental health and energy restoration. In fact, the presenter is here, William Power presented on that from Canada. And we decided to do this again from a different perspective. And the person that we will be interacting on this particular topic today is Henderson Mhango. Henderson Mhango is a lawyer, and he is also a human rights lawyer, social activist with a bachelor degree of law. Also, he has advanced diploma in business administration and management studies. Henderson is a well-seasoned human rights and governance activist, a founder and executive director of Youth Coordinating Agency in Development. In short, it's called YOCADE, YOCADE, a non-governmental organization working in 4 thematic areas of sexual reproductive health rights, mental health and suicide prevention, and early childhood development, targeting the marginalized or underserved people in the rural communities. Henderson Mhango holds a leadership position of National Coordinator of Forum for Democracy and Rights Defenders. He is also a chairperson of Blantyre District Education Network. He's a board chairperson of Lifeline Amken, also a chairperson of Human Rights Defenders Coalition, Southern Region Chapter in Malawi. So this guy is well seasoned in a lot of social issue and also a lawyer and human rights activist. So without further ado, I have to say, Henderson, thank you so much for accepting this invitation and willing to present all your work on mental health and suicide prevention. I think we were all gonna learn a lot of stuff from your presentation or this discussion, and maybe you can also learn 1 or 2 from our participants for today. One thing I have to say, please, towards the end, if I open it up for questions, if you have the capacity to be on video to pose any question or comment, that would be great. But everybody's welcome to chip in because we are all in this together. One more thing I have to say is that please, if you're not talking, just mute your phone so that there will not be all these background noises that will be coming through. Often this happens by accident, people accidentally will unmute themselves and didn't know somebody else is talking on the background. But that's all I have to say. So without further ado, I will turn it over to Henderson Mhango. Do you have anything to tell your audience before we start? But also, I had to say one thing before I turn it over. Please go to chat right now. You will see Henderson information, phone number. He had also his email address and website. So it will be handy in case if anybody likes what we discussed today that wants to reach out to him, please go there and get that information. And also, I have to remind people, for new people that have not subscribed to Public YouTube channel, please go ahead, subscribe, take that subscription, share with your family members, and recommend for them to subscribe. This is the only way we promote what we do because what we talk about right now is not just for you, it is also for other people. So once you get that knowledge acquisition and transfer, it is not just meant for you to hug it and keep it. It's meant for you to share with other people. Yes, unsolicited, but sometimes you have to solicit to people to listen to what you have to say. Because I can tell you a lot of people probably don't know what's good for them. Sometimes it's for us to really, send the message home and provide information, relevant information and credible information to many people that probably looking for those information but doesn't know how to get the information. So I'll turn it over to Henderson, please. If you have anything to say, just say it, then we can go through the questions that I have for today. Thank you.
Thank you very much, Doc. I hope I'm audible enough to everyone. Like you said, my name is Anderson Mahango. I'm from Malawi. I'm the Executive Director of Youth Coordinating Agency and Development. I hope you have already elaborated a lot of things, so we can just maybe start.
Okay, thank you so much. So mental health and suicide has been increasing for years now. And I know you're a lawyer. One of the questions I have here to start with, just to break the ice, please, can you tell us why you entered into this space in terms of the space of public health? What prompted you to get into this space to be able to do the work on mental health and also suicide prevention?
Thank you very much, Doc. I've been an activist for some years, almost 20 years. And I've worked with so many organizations, and I've also attended different career courses.
Can you hold on, Anderson, a minute? I think you're not on video. Can you turn on your video camera, please?
All right, because I was afraid of the network. It was not good. So let me just organize it.
Sorry, everyone.
Yeah, you can able to see me now?
Yes, we can see you. Go ahead.
Yeah, so like I said, I've worked with a number of organizations, human rights organization, and I've also attended different career courses, including business administration and also community development, which I didn't include on the information I shared. And with that experience I gained, and also passion working with the community, that's when I developed the passion to be working into social issues and also health issues, including mental health and suicide prevention. And we started our organization in 2010, and it was before I even got into a law school, because I went into a law school in 2013, and our organization was registered in 2010. So you can see that even before, I've been working as a social worker before I become a human rights lawyer. So what I can say is that since my life, I've been a person working with people in the community, that's where I developed the passion.
Good. We always welcome anybody in public health space, because it's a big space. There's so much stuff going on, especially
Yeah,
also
exactly.
this time around that I'm here in the United States. The federal funding has been cut in many programs. I don't know how it is over there in Malawi, but right now in the United States, both state, local government, um, federal government agencies that are working in some of this work are really struggling because they had to find some money, to continue the momentum of the work they're doing. But again, that's a different topic because it's taking me to my publication I did last year on sustainability. Often, many experts in this field just uh, take sustainability as downstream approach instead of upstream, but that's a different topic. So I'm gonna move on to the next question I have for you, which deals with barriers in mental health and suicide prevention, barriers you or your organization have encountered in Malawi. How did you guys address those barriers? Just give us an idea, some of the barriers that you guys are encountering regarding mental health and suicide prevention.
Yeah, I think like any other country, we also have so many barriers working into the mental health space. For example, here in Malawi, we have insufficient mental health structures to complement our interventions. So we have only one mental health hospital here in Malawi, which is Somba Mental Health Hospital, and we have also inadequate professionals who are in that space of mental health. The other challenge, I think, which I can also share you, is also the cultural belief that also sometimes give us a setback on our interventions because most of the people who are culturally uprooted in the community, they view mental health issues as something which is not relevant to them, and they have their own understanding of mental health. So that one also, it gives us a very difficult situation to at least tackle some of the issues concerning mental health. So culturally here in Malawi, a man is supposed to withstand heat or any matter for himself without sharing other people. If you share, it seems like you are weak, and people they start criticizing you. And also, if you look at the other cultural beliefs, they view those who commit suicide as demonic and possessed people, and they can also sideline the families who are victim of the same.
This is interesting. I will come back to the cultural aspect. Actually, that's the follow-up question I have. But let me address one thing or have you expand on one thing that you mentioned. You said that there's one mental health hospital in Malawi. Now, the expansion I want to understand on that because Malawi is a big country. To have one mental health hospital in there is kind of a little bit mind-boggling. So there are different types of mental health. Example is anxiety, depression, and so forth. Those are kind of like it's still mental health issue, but it's not as severe as we're talking about schizophrenia and other pathological most extreme part of mental health. So is this hospital a psychiatric hospital or just hospital that deals with variety arrays of mental health? And why is it one mental health hospital in Malawi?
Let me clear on that one. That one, I said there is only one mental hospital, a public one, but we have also a private one. But the demand of public, it only relies on the that one, the only uh, uh, mental mental health hospital in Zomba. So that one, it deals with a variety of issues to deal with mental health. So that's why we have so much demand on the public. Those who cannot afford to go into private hospital, in Malawi, most people, they don't have resources that they can afford to go into private hospitals. So the only hospital we have is only the public one is only that one I've mentioned in Zomba.
Okay, the one in Zomba is it only for Zomba community or anybody from any region in Malawi can also
No,
have access to it?
it's the only mental hospital here in Malawi. Whether you are in the other district, if you have critical problems, you are supposed to be sent into that hospital.
Wow.
But as of now, they are now trying to maybe having some doctors within other hospital, which are not mental health hospital, who can able to assist at least the people within the community.
Interesting. So again, it's probing into this question because one mental health hospital in the whole country is public, just for the
Yeah,
clarification.
yeah,
Public mental
yeah.
it's still problematic for me because I'm in public health space, right? So um, now, is scientists or even public health expert or clinic don't see this as an issue that there should be more than one public mental health hospital in the country?
Yeah, that's why we started the robbing government to at least increase uh, specialists on mental health within the other hospitals who can able to attend people within their districts, because than to rely only on the Zomba mental health hospital. So at least that's when they started hearing from us and also starting to increase number of nurses and also doctors who can able to help people within the community. So I can say it's a challenge, of course, which we are still pushing government to make sure maybe in the future we can have more public mental health hospital, and people can able to at least being assisted within their localities.
Please, I'll be interested to know how that advocacy is going because I think there should be multiple public hospitals or even not hospital, maybe clinics, public clinics that deal with mental health in the country. It shouldn't be one. One is not even scratching the surface. And again, this is actually good that we're getting this information because it kind of provide a template on how minimal a whole federal government in Malawi sees mental health. So they don't, probably this is a good example that because they don't see this as an issue, a big issue, there's no need for them to expand and say, you know what, multiple community, there should be access to clinics, hospitals that deals with mental health. Because if you look at Malawi as a country, I don't know the location of where this hospital is. Let's say if it's in one side of the country and you're on the other side of the country, if again, remember, based on the information we get from you, people that goes there is because they cannot afford private. The same, it limits the access for people to even travel because now you have to travel from one end of the country to the other end of the country to go see a specialist and take care of your mental health issues while you still don't have money to attend maybe private mental health clinic that's very close to you. You're still spending a lot of money traveling. So it's an issue. But we can
Yes.
still dive on this later on, but go ahead.
Yeah, I think that's why we try hard. We started our advocacy in 2020, trying to push government and other key stakeholders to make sure we have access. I mean, people, they have access to mental health services and also information. So that's when they start now looking at mental health as something which they can able to invest to save more people. If you see currently, even last year, starting from 2023, you will see every year at least 295 to 300 people, they die each year because of suicide issues. So we are trying to make sure that the government should understand to increase accessibility of mental health services and also information for the local people who cannot have enough resources to find those services in private hospitals, or who can not able to travel far to get those services.
Thank you, Henderson. Just to give everybody overall picture of mental health. So, hundreds of millions suffer from mental health issue yearly over their lifetimes. In Malawi alone, 9.6% of women and 6% of men have mental health issues. In the US, 1 out of 3 women have a type of mental health issue. Then globally, 9.3% of men have mental health issue and 12% of women have mental health issue, right? So that's kind of like the overall picture of mental health. And this number is increasing as we go. So 9.6% in Malawi for women and 6% in men is a big number. And
Exactly.
but knowing all this information, I will also want you to discuss the scientific evidence and cultural background basis of mental health and suicide prevention in Malawi. So we already know they have limited access to public hospital that specifically address mental health. I don't know the status of health insurance in most communities in Malawi, whether people have free health insurance. But again, I will want you to kind of like discuss any type of scientific evidence or telecultural background basis of mental health, specifically in Malawi. I know you started touching on it earlier, but can we expand on that?
Uh, Scientific evidence indicates that Malawi faces a growing suicide pandemic, particularly among young men than women, with significant treatment gaps from common mental health disorder like depression and anxiety. Common mental health disorders such as depression and anxiety affect a substantial portion of youth, especially men in Malawi. So culturally, men are the ones who suffer much than women because if you see culturally here, norms expect men to suppress their emotions, which prevent them from seeking help. This has also led to stereotype that men are fundamentally strong and better equipped to handle challenges or situations by themselves. So there's a phrase there which says "mamuna salira," which means a man does not cry. So it means a man is supposed to fix his problem by himself without involving anyone. So that one has also left many men who are ignored and who are also killing themselves. That's why if you see on the statistics, for example, last year it was 281 people died committing suicide, and out of 281, at least it was 200 and 264 were men and the rest were women. So you can see the gap there, that men are the ones who are suffering in silence. And the majority of women, they are able to open up and also seek for help, unlike men because of the culture itself. So you can see each and every year, for example, even 2024, I think that's when it was 281 people died, and 146 were male, and while 35 were female. In 2023, 198 were male who killed themselves, while 22 were female. So you can see the gap there. Men are dying. More men are dying than women. Why? Because of the cultural thing. So that's why we are saying we are much affected with the cultural setup, that men cannot seek help to anyone. Men can die with their issues for themselves. So it's a very big issue, which we are also trying to engage the community to change the mindset and also to influence on the cultural understanding on mental health.
This is a very good number in terms of suicide because of the fact that I 100% agree with you. And this, the cultural aspect of manning up and doing stuff is not just African issue. I think it's a universal concept where, man is tough enough to handle situation. On the other hand, it's also a bad message because, there are so many men that might be suffering from stuff. And now, not only that, too, the modern construct of demonizing masculinity has also become an issue globally, right? Like, they have to demonize masculinity, and then if a man does something, oh, he's so weak to, you should handle it. You should be okay to go through the society carrying the whole world on your shoulder. You can't just say anything. If you say anything, then you're canceled, right? So, and that is very, very important to the question I'm also posing here because I'm from Africa. from Igbo. I know that culturally, it's a taboo and it's an abomination for somebody to even kill themselves. It's very, very rare in my culture, more traditional to commit suicide. It's not that it doesn't happen, but very, very rare, right? But now with this modernization of the society, I think it's becoming more prevalent. So I don't know if you guys, if you are observing that based on the work you're doing in Malawi, due to the modernization of the society and lack of cultural value as well, is making it okay for people to just kill themselves instead of seeking help from other, even I'm not advocating anybody to diagnose themselves or treat themselves, but often you can see men having discussion with themselves on the issues they have, but also looking at the number you mentioned, whether you guys were able to stratify the numbers by marital status, because also that's where women comes in. If these men are married, right, you can see their wife playing a big role in their life and say, hey, I think you're going off the rail. You know, you see wife support coming in and say, you need help. I can be there with you to need help because that's if you need help. Because there's another study I read, years ago, not a long time, but maybe 2 years ago, where they showed that not just for mental health, but other conditions, for example, cancer. They showed that men that are married or couple that are married get more support when they have any type of chronic condition compared to single people, right? So there's marriage have a role to play as well. Not that marriage doesn't have a role to play for some people that commit suicide, but actually in terms of social support. So I don't know if you have observed that. And also another thing I want you to expand on is enhanced diagnosis technology for mental health and suicide incidents. How are you guys enhancing those type of diagnosis technique to be able to identify people early on with mental health? But first, I want to see the social aspect in terms of modernization. How, whether, I don't know if you observed that, but if you did observe how modernization and cultural disintegration the role is playing in either mental health and also increase in suicide in Malawi.
Yeah, like I said, we are very much behind in terms of how to identify issues of mental health because it's like now where more players are coming in to at least help to make sure people are able to understand issues of mental health. But previously, people were not taking mental health issues serious because maybe because there's no facilities to at least where you can go and also present yourself. Government were also not collecting data concerning the issues of mental health, even suicide issues. It only started, I think, in 2020, where most organizations they join up to at least push for information and also start advocating for mental health rights for people in the community.
Thank you. So what would you say is the purpose and significance of intervening for mental health and suicide prevention now among youth in Malawi? In other words, what I'm trying to get here, based on your observation and based on your work, should we start intervening regarding mental health as early on as possible, maybe have, I'm proposing things here, maybe have like integrate that into school curriculum, start talking to younger girls early on as possible and younger boys early on as possible about mental health so that at least they know that it's okay for them to go ahead as soon as they have any indication about them not feeling well, feeling depressed, because depression, anxiety is the early on symptoms of this before it goes to the point where somebody has to kill themselves because it's something cumulative. It's not just something that they just thought about killing themselves and they kill themselves. It goes for a while and unchecked, and that person will just check out.
Yeah, I think it's important to start involving the youth, even trying to uh, put up something in the curriculum so that the young people can able to understand issues of mental health at the tender age. Because once we start engaging them, it will also help to influence the deep-rooted cultural understanding on mental health, and they can able to know the right way how they can serve their rights. Because without doing that, it means a lot of young people they will be also doing the very same uh, other people are doing based on the culture.
Okay, we lost you for a minute, dear. Can you repeat what you just said? Hello?
Can you hear me?
Yes, I can hear you
Yeah, can
now.
you
Go
hear
ahead.
me?
Go ahead.
Yeah, I was saying it's important. I think it was yeah, it's important to engage the young of the tender age because it will help them to understand issues of mental health, and it can also help to influence the deep-rooted cultural understanding on mental health. So once we are engaging them, including the curriculum, it will help the young people to serve their lives and know the better way how they can able to handle mental health issues. So to me, I think it's a right way to start with the young people so that we can also trying to prepare the generation how they can able to help on mental health.
Okay. I know you mentioned that men die most of suicide, which you share the data. And you also mentioned one of the reason is that men is always seen as the strong element in any society, which is true. However, that overzealousness about being strong in a society, it creates a stereotype where even if they're suffering, they cannot share information or seek help. That's well taken. Now, is there any other sets of cultural themes, specifically cultural themes specific to Malawi that you observe, cultural themes, social indicators that you see, globalization construct, it could be the work uh, attitude, the work schedule, and so forth, income or whatever, that you see that predispose men or youth to a higher risk of mental health and suicide prevention.
Yeah, I think the other thing I can also maybe share with you here is uh, concerning the marital issues. It's also connected to men being the breadwinners. So men being the breadwinners, they are supposed to do everything for a woman or the family. So once if you are not maybe working or you are not doing anything, also you maybe you have been sacked
at your workplace, it means the burden, it becomes worse for a man to survive, because the woman will still looking for you to at least bring something to the family. So this one has also uh, bring a lot of men into troubles, because some of them, they are killing themselves because they are failing to at least feed their families, also sustain their families. Again, the early marriage itself, most of the youth, they marry at a tender age. Maybe some of them, they can marry at 18, 19. So you can imagine that family, that marriage of people who are maybe 19, who are not even working. So if they are staying together, they also do find a lot of problems, and those problems, it goes back to a man who is head of the family. So that one is also another thing which is contributing a lot of suicide cases, because most of the men who are committing suicide, you hear them that they are saying, maybe I'm not valued enough at home, so I cannot able to feed my family, so let me go. Maybe if I die, maybe I'll have peace. So most of them, they will kill themselves because they are failing to at least help their families. So it's a very big issue, and you see so many men getting into trouble because of that kind of situation.
This is very important because this is oxymoronic, right? So early marriage, you get into a marriage, you're not even financially stable, you didn't even have a job, you get yourself in a situation. Probably you might have one or two kids or three kids. And then the mindset of mental health, depression, and anxiety in that person's mind, okay, well, I'm just gonna take myself out, the problem solved. But actually, technically, the problem is worsened out because now you either have a wife with all the burdens and children with no father. So it's interesting. The other aspect, the marriage part, is also cultural to many African countries. So I think my advice, and I'm sure you have similar advice, since now we know the trend, it's not like the women are not having mental health issue because I just showed the statistic, they might have it, but the men die the most of the mental health issue because of the burden of the family in terms of income driven, which is also cultural thing in many African countries where the man's supposed to be a sole provider. The message will be to many young men out there, I think you should focus first on your uh, stability. Once you become stable, then you can engage yourself into getting married. But another solution will be for the government of Malawi to notice that one of the major reasons why these young men are killing themselves in Malawi is because they bear almost the major share of the burden of the family burden financially and otherwise. So then that means that uh, the government has to start working more to be able to provide jobs across the entire country, right? So that's another major alternative. Creating job is very, very important because if that opportunity is out there for most men, young men, I think it will reduce the incidence of suicide that you are discussing about. So I think that's what I have to add in that particular theme that you discuss about or the two cultural aspect that contributes to high suicide rate in Malawi. Is there any other thing on the cultural aspect you want to add?
I think those are the main ones, and maybe those are some of the main factors which trigger problems on mental health. So I
Okay.
think
So we know the problem now that you encountered. We know the significance of these issues, mental health and suicide. Let's go into treatment and intervention. So often public health interventions lack cultural integrity. And what I mean by that is cultural humility. You go in the lab or you go in scientific environment, you do type of study, get a result, and most often we ignore the fact that it could be one or two studies done with a specific target in mind. And then you get a positive result and you think you can just spread that word and let everybody use that template and everything is good. So understanding this, when you guys do intervention on mental health in Malawi, do you guys account for cultural integrity in terms of the way the society is structured culturally and the way people have their cultural belief system to be able to have the optimal outcome in the intervention you implement within Malawi for mental health?
yeah, exactly. It's because it's important to first of all understand the cultural aspect of different areas. Here in Malawi, people they have different cultural beliefs. Those from the north, south, east, and also on the central. So, for example, we have uh, those who practice patrilineal marriage, some who are practicing matrilineal marriage. They have different issues when it comes to mental health. So, first of all, we go there to understand their cultural context. And then that's when we involve them to work together to find solution through dialogues. So we involve them through dialogues because we cannot just go there and say you are supposed to change this practice, the cultural practice. They will not understand. But first of all, we engage them and we also try to make sure they give us solution how best we can able to find solution on particular problems depending on what they are practicing in that particular area. So what we do, we always engage the community through community dialogue, sensitization, so they are able to also give us solution how best we can able to work on issues affecting them. So that's how we do it.
This is interesting that there's two things you said that caught my mind. You say paternal and maternal marriages. And we already know from what you say is that uh, man bears the burden of income-driven family burdens, right? So can you expand on the paternal marriage and who bears the burden of the share of the family burden within paternal and maternal marriage? Could you also share expand on that? Who bears the burden, whether it's the woman or still the man will bear the burden? And then what I want to know, because I didn't, I want to know from you whether depending on what you say, whether in the maternal, do you guys also observe, even within maternal marriage, that men are dying the most or the opposite?
Yeah, I'll start with the matrilineal marriage, where the power is invested to a woman. And as a man, you are supposed to move from your home to go into the family of a woman. There will be maybe a village. They will give you a land there to build a house for that lady you are marrying, and you'll be staying there at the woman's family. So that one, it has a lot of problems because you have more problem as a man, but you cannot escape there because you are there. They'll be treating you anyhow because you have come into their place. So you have no power to control them. They will do whatever. You'll be just a person to provide everything. So most people in that type of marriage or marriage setup, that's when it brings a lot of cases of suicide.
Wow.
For example, we have a certain district called Chirazuro, where women, they are even making it as a business. They can marry someone and build a house, they will chase him, they will find another one. Another one will also build a house, they will chase that person, they will marry another one. So it becomes like a business, because here, even if you went to court, the court, they say, okay, it's a matrilineal marriage. It means you have to build a house to your wife if you want to divorce. So that one has also giving a lot of problems for men who are into that practice of marriage, unlike patrilineal marriage, where a man is in control. It is practiced in some other district of the country. And that one, it has a lesser problem than the other one because of what I have just explained. But it happened in some of the districts, not all the districts. Like, for example, the district I've just mentioned in Chirazro, where a lot of cases concerning men being abused by women because they are into matrilineal marriage. They can marry, they will buy everything, but you will be chased without being given anything. So to them, the women, it becomes a business now. They can invite someone, they will marry another person. Then if they are divorcing, you will not get anything. You just leave the house at the wife's home. So that one, we have received so many cases of men complaining in that particular kind of marriage setup, unlike the other setup of patrilineal marriage. So that's what I can say about these two marital setup.
This is very interesting. So I just want to make sure I understood what you're saying. If I compare patrilineal marriage and I compare matrilineal marriage, in terms of men committing suicide, it's higher among men that participate in matrilineal marriage compared to those that men that participate in patrilineal, right? That's kind of like what this is.
Because patrilineal here is what we called Chikamwini. It's a vernacular language, Chikamwini, where you are supposed to go to the
Husband side.
Yeah. So where the patrilineal, a man is now in control. You are supposed to get your wife and at your home. You can build a house at your home. It means that house, it becomes yours. And we have now a fused one where in town they can mix a lot of maybe patrilineal and matrilineal because they are on a separate environment. Maybe here in town they can build a house. But when the case went to court, the court, they will look at the formality of the marriage, whether it's patrilineal or matrilineal, and they will judge based on the cultural setup, how that marriage is set up. So it always affects the other part depending on which type of marriage you are in.
Before I say what I need to say on this topic, because this is an interesting part that you just mentioned, but before I say what I wanted to say, let me ask you one more question on this. For women that are married, now I'm not talking about single women, women that are married in Malawi, that suffer from suicide, what is often the key reasons why women do commit suicide if they do commit suicide?
For women, I think most of the women are young girls, and for young girls, it's about relationship issues. So when there's a breakup, you find out that most of them, they cannot contain the sadness of that situation. That's when you find out many women, especially the young ones. If you compare the rate of suicide, you find out that for the women, the ages, they are very maybe 15, around 15, 18, up to 25 to 30. But for men, it goes up to 40, 45. That's when there's a difference between men and women. But for other grown-up women, you find out that maybe marital issues, their husband, maybe they are cheating on them, maybe they have been chased for the marriage. I think those are the main reason where maybe women cannot contend and they are committing suicide.
Yeah.
Unlike men, it now goes into issues of problems, financial problems, socioeconomic issues, and maybe few cases on chronic illness, for example, HIV and other diseases. It also prompts other people to commit suicide. And it's a general thing. Those are some of the general things. And there's also, I think for the men, it also driven them to enter into gambling. There's a gambling business here where the little they have, they will invest in gambling and they will even go into debts, borrowing money to do gambling. So once they have a lot of debts, that's when they become now suppressed with anxiety, depression, and they can also commit suicide. Most cases, they are also coming from that angle.
Yeah, thank you so much for all this information because I always believe, based on the information you provided, and I hope the audience that are listening can understand what I'm about to say because there's could be a lot of pushback, which it doesn't really matter. I'm looking at things on objective truth. I always think that suicide in the world and specifically here in the US, and what you just said supported my hypothesis, is underdiagnosed. That's one. Second, I also think that domestic violence and abuse is the way we collect data, specifically in the US, is biased. Is biased because often you will see men being abused, but because of the cultural value we just talked about, where men need to swallow their pride and all that stuff, here in the US, obviously, most of the database is based on who calls the police, right? And often, women will call the police. And this gives you a picture of how data collection and method of data collection can take you miles away from the truth. And we always go by the fact that it's often men that abuse their spouse, but that's not actually scientifically accurate because if you taken all the calls made into the police station to put it as domestic violence, obviously majority of men, over 90% of men will never call on their spouse for domestic abuse. Maybe it will come to the point when maybe stabbing or shooting, maybe at that point, but normal thing they won't even call. But obviously, women call all the time. Now, I'm not advocating anybody now to call police if there's a domestic violence, but also bringing people's attention to how the data is collected. The method through which the data is collected gives you information about how the data is collected. And if it's collected in a way where is unbiased in terms of total number of calls that were made for domestic violence, then you will see that domestic violence is basically could be 50-50. The same domestic violence that men commit, the opposite gender women commit the same thing, right? So let's also be objective in looking at things and make sure that we are questioning things, and maybe that's how we can change the system and say, hey, maybe there's an alternative way to look at this. Because what you just said about uh, matrimonial marriage, I have had this kind of hypothesis for a very long time because I'm specifically thinking about the United States domestic violence. I never believed that men commit most of the domestic violence due to the way the data is collected, specifically in the United States. And now when you say this, I was like, wow, and I'm not surprised, but I was like, and that's why I asked the question. But that's very, very important insight that you provided to us to consider. The moving forward, could
Sorry,
you go
cut
ahead?
you short. The other thing I didn't, I think, mention is about the penal code here. The penal code, it criminalizes those who attempt to commit suicide. So people are hiding to share information about mental health or whatever concerns suicide because they will be afraid of being arrested by that penal code. That's
It's
why in our
interesting. Instead of providing more hospital to provide care for these people, you have a penal code to even punish people that is
we
getting
have
to the age. Okay.
a penal code here, section 229 of the penal code. It criminalizes those who attempt to commit suicide. So people who are depressed and they want to commit suicide, they are now afraid of going to the hospital to explain something because they are afraid that they'll be arrested. That's why we were also advocating for decriminalization of the suicide attempt laws. And we started with a number of different organizations in I think, 3 of African countries. I think Nigeria was also one. And some of the countries, they have advanced their agenda and they have passed a bill to decriminalize the penal code. But here in Malawi, we are still fighting to make sure the law is repealed so that people can be free to go to the hospital and explain themselves if they have problems.
Thank you for that key point. It's very, very important. Decriminalizing a suicide attempt. Hopefully, that law will pass so that we can actually provide the health care need of these people. I don't believe that nobody in their right mind will go ahead and decide, you know what, I will unalive myself. So I don't think anybody that does that has their stuff all intact. So those people really need help. They need help. They don't need to be stigmatized and criminalized because they're suffering from anxiety and depression. They need empathy and they need support. That's what they need. Thank you so much. So, in terms of surveillance, is there any surveillance system that's either nationwide or statewide in Malawi that are capturing all this accurate data, or is Malawi still being supported by foreign agencies for their surveillance on mental health and suicide?
So far, we don't have the surveillance. Since I think we started our intervention, we haven't heard something like that. But of course, for this government we have, it is showing a political will, where I think many things will be upgraded and things will also change because of the recent passing of the mental health bill. I think it was on 10 April 2025. That's when President ascended the mental health bill here in Malawi, replacing the outdated Malawi Treatment Act of 1948. So this bill now, it will shift the approach to mental health care from a medical model to a human rights-based approach. So that one is also a milestone to Malawians, at least for an issue of mental health that we are progressing. But inside the bill, I think there are also some recommendation to repeal some of the laws, the punitive laws, which criminalize attempt suicide laws. I think it also gives a room for those who are suffering from mental health to have access to mental health services. So for now, we can say we are moving forward, and we hope that the government will continue to at least putting more effort on the mental health issues.
Thank you for that information. And if I may ask, what are the social implications of mental health and suicide prevention in terms of the work you've done in your kid? And also, what are the lessons learned or lesson objective overall regarding mental health and suicide prevention work you've done?
Yeah, I think what I can say is some of the implication is based on the culture which we have already explained. You know, people, they have different understanding on issues of mental health, and also the laws which also affect people to be open to share information, because people will lie to avoid being arrested. So, for example, we did a research, I think it was last year, where we go into major prison, 3 of the major prison here in Malawi, looking for people who have been arrested on attempt suicide, but we didn't find anyone. So we asked the police. They said, no, we do have those cases, but we don't arrest them. We just advise them, then we left. But the law is still saying that you are supposed to arrest them. So there is an inconsistency between the two. That's why we said no. It means people here, they are in need of mental health services. So government should also increase so that people should have access to mental health, and the mental health service should be available. We should advocate for availability of mental health service everywhere so that people can be open up and share the true reflection of what is happening concerning mental health. Because like you say, people can lie. Some of them can lie to avoid something. So they'll say, no, I don't have any problem, because they'll be saying that to avoid being arrested or being misquoted so that they can be maybe caught by the police or whatever. So this is also something which has also been a challenge to us fighting for positive mental health in the community.
Thank you so much. And And if you need anything, my organization will be able to help and support the work you guys are doing. In Malawi, my door is always going to be open in this type of work. But then the final question I have for you will be, based on
And
all these experiences and the great work your team have done in Malawi, what are the practical application of all your observations in public health setting, in clinical setting, and community settings? So I know that we have touched on this, but what is the message you will send the audience that have listened to this, or if that will listen to this video, in terms of the practical application of what you are aiming to achieve overall with your organization in partnership with other organizations in Malawi regarding mental health and suicide prevention?
yeah, so like I said, our organization is much based on community engagement and education. Initiative aimed to raise mental health literacy within the community and combating stigma and promoting better understanding on mental health condition, which is crucial for increasing demand and access to mental health. So we didn't just sit down to wait for government to build more hospitals, mental health hospital, but we are trying to train mental health champions within the community so that they can able to help their community, to help in their community. So, like for example, we have engaged three districts: Blantyre, Zomba, and Chirazuro. In those districts, we have trained 20 counselors each district. So those counselors, they work hand in hand with the Minister of Health. So in the Minister of Health, each district, they have what we call an office which is called Mental Health Coordinator, where we find a person who coordinates all mental health issues. And that person is the one who helped us to train the counselors within the community. Because some of the people, they are in very remote areas where they cannot even, to go to a hospital, you have to travel maybe 100 kilometers. So where there is no maybe a facility, we train champions who can able to attend on mental health issues. And we do also provide a handset, a cell phone, where it can be pressed within the community. And those who have problems, they can able to call and talk to a counselor. So at least within those districts, we have able to manage to reduce cases of suicide, and also people are able to open up, especially men. That's when we hear a lot of things in Chirazlo where they practice matrilineal marriage. A lot of men, they came out and also explained their experience in the district. So it's a very good initiative. Unfortunately, we didn't have enough resources to cover more districts, because here in Malawi we have 28 districts, but we are only doing it in 3 districts, which I've just mentioned. So it's also a challenge for us, but we are still looking for other well-wishers who can also help us to expand our programs.
Thank you so much. This is amazing. I learned a lot of stuff in this podcast regarding the impact of mental health in Malawi community, among women in Malawi, and among especially men in Malawi. I wasn't expecting the information that you provided in terms of the major theme and cultural aspects that implicate high rate of suicide among men in Malawi. This is amazing information. Now that we know what's going on, it is part of our role to seek partnership with organization and support the work you're doing, whether it's through grant or whether it's through just passing along resources, scientific resources, and have your team look at it and also tailor those resources to culturally relevant approach to be able to intervene. Mental health is real. It's not illusion. It is not a belief. It is scientific and it's objective. Suicide is real because it's only incidents. That person dies, they die, right? So please let's not stigmatize suicide. We are all in this together. As a community, we will always survive. Thank you so much, Anderson. And also, if you can tell people on where to find you, that would be great. If you take this opportunity to just tell people where to find you.
Yeah, thank you very much. Maybe before I share where to find me, I just wanted also to share the statistic as of now. From January to March, we recorded 153 cases of suicide here in Malawi, and 125 cases were involving male, while 28 were female. So you can imagine for that period, it means closing this year, it will be even more than that figure, maybe 300, or it will go maybe up, because situations are tough here, especially on the economic side. And that is the main trigger point where many people are trying to commit suicide because of the hardship, economic hardship. So I wanted to share that one. For the information, I think I've shared on the comment section. I've put some information where they can find me. They can use an email. They can use my phone on WhatsApp. You can able to share some information. Thank you very much.
Thank you. So I open it up for the audience that are participating to either add to what we have discussed or pose questions to Henderson or pose question openly for public to either provide their experience and response to the question. So I'll open it up. And so please, if you want to make a comment, suggestion, pose question, please be on camera and go ahead and pose the questions.
Dr. Amalo Anderson?
Yeah, go ahead.
Hi. I'm not on camera. I don't have that ability to say where I am at. So I want to say what a wonderful, it's Mr. William Power. Okay. What a wonderful information. And, it just, what you pointed out, and it just opens me up even more to a saying that I've come up with, and that is, we have mental problems because of mental policies and mental government and mental guidelines and mental laws. Imagine if it was the opposite, And I think what you're doing with the community is a wonderful thing, because that's the start. You're already getting results. You're in 3 of the communities or districts, and you got 25 more to go. And I just want to, encourage you with all kinds of power and love to continue that work. Do you need what kind of help do you need from the rest of the world to accomplish this sooner than later? To have these little groups to train these people that go into these districts or communities that are making a difference. What is it that you need?
Yeah, I think
We are lacking some of the equipment. For example, like I said, we have 28 districts, and we are only targeting 3 districts because we can able to reach people within those districts because they are near our offices. But for those who are far away, it means you need maybe a vehicle. For example, situation like emergency situation where it is happening far from your area, it means you have to book a taxi to go into that area because we don't have an emergency vehicle which can take us where to help someone who is far from us. And again, for the trainings, for example, per district, we were assisted by a certain international organization with the 30,000 US dollars for 10,000 each district, and it helps us to train those champions within the district who are now doing the commendable job of counseling and also meeting people, trying to influence the cultural understanding on mental health, and also working hand in hand with the government. Because what we do, since some of them, they are not professional medical doctors, we do work in hand with the government. So, for example, in the district or in the community, they have what we call community health centers. So in those community health centers, if a counselor in the community has a problem which is beyond him or her, it means he's supposed to do a referral to the government hospital. So we also lobby for the government to give us at least one mental health doctor in each district where we can able to work hand in hand with them to share information and also do a referral work. So for now, we are limited because that grant was only to cater for those districts. And we are just trying to do some fundraising where we can get more resources to reach out into other districts. The only challenge with our government, politicians in Africa, they are only concerned by themselves. Once they are elected, you will be just hearing cases of corruption, taking money, issues of health. They don't care. If people, they will be dying, but they will not care. You can see the numbers of people who are dying here in Malawi with suicide issues. But government, they are not that much serious into it because it's a chaos as of now. In a quarter, you see 150 something people dying, but there is no mechanism to at least support the system. So maybe in short, I can just say we are still looking for resources and also well-wishers who can also help into our interventions so that we can use our local model. We use our local model of training the local people within the community so that it should be peer-to-peer. If you train someone in the community, they will be able to understand him than a certain person coming from somewhere. But if you train someone from there, you'll be able to link up to his fellow men or his fellow women. That's how it goes. Here, that's why we have introduced men groups where men, they are able to meet and also share some information. Thank you.
Yeah, fantastic. Yeah, keep the focus. Keep the focus and live it like you are. Your passion will make things happen with God and the universe, 100%. And you're battling up the hill, but there's more power in your community. I love that. And work with the community. And the other thing I just wanted to point out, question, how many cell phone companies are there in your country? 2, 3?
Currently, we have the main one 4.
Yeah. What are the names? Any names I would know?
There's Airtel.
Yeah.
And we have for TNM, it's Malawi Telecom Communication.
Okay.
Yeah, and we have MTL.
Are they private, or are they government, or are they privately owned, or big corporationally owned?
One of, like MTL is a government, it's a parastatal, but the rest are private. That's why we are also to launch a national hotline, but we are still looking for resources. But we applied to the government to give us a short code that we can be using as a hotline, but we haven't yet launched it because we don't have resources as of now. But we are still looking for resources to launch that helpline together with the life.
It'll happen. It'll happen. The reason why I ask you about the cell phone companies is because, especially the private ones, they're always looking for an edge of marketing. And if you can somehow, some way, sit down with, the CEO, CFO, some upper management, and make them aware that mental health is what it is, they can do amazing things like have a mental health day, and for all the text messages done on that day per year, that money goes towards your program. Not only that, this will help make them look like a good company helping the community. You understand? You got to think in the you would go in there. You're telling them, hey, this is mental health in our country. Do you want to have more subscribers, more cell phone subscribers? This is one way. Make yourselves look like a company that's taking care of the people. Go in there and knock on their doors, get in there somehow. And, within months, you never know, you might strike up a deal and a partnership, because this has happened in other countries already. It's slow, but you got to start somewhere. But anyways, I just wanted to point that out, and I feel that you're the man to do that. You got the passion for it. So
yeah, exactly.
Take your team and make it happen, my friend.
Yeah.
Thank you,
William, this is a great idea. That's a great idea. I hope it will work, because the level of greed in some of these companies in Africa is amazing, right? So that's why we need to account for the greed level. But I don't want to be negative, but this is a very, very good idea, that if you can reach out to them and say, hey, we're gonna do this, and um, it will really help your company um, in the nation, that you guys are the only ones supporting Mental Health Day and Suicide Prevention Day. So that's a good idea. Thank you so much for that great recommendation. Anyone else?
Dr. Mello, I'm on the phone. Can you hear me?
Yes, go ahead.
All right. This is Teresa. This is so informative and just educational. My question is, Is there any issue beside what you listed with marriage, early marriage, and men being, the breadwinner and other social indicators? Is there a problem with drug abuse, use of illicit drug? Let me put it that way. Contributing to mental health in Malawi or suicide? I just want to know.
Yeah, that one is also here, but it has a very small numbers of cases comparing to what I have just shared. Because drug and substance abuse are much based on young people. And it's now much connected with the gambling, because gambling is now taking a huge space for youth to commit suicide here in Malawi, unlike the substance and drug abuse. So it is happening, but it's not that giving a huge number comparing with what I have shared.
Okay. Thank you for the response. What about women of childbearing age? I know you explain it so well, the differences in terms of the matrimonial and the patrilineal marriage ceremony. And in the area of women, regardless of which form of marriage they are engaged, do you have data to support women who commit suicide in terms of being, whether they are pregnant or postpartum depression? The reason this is my area where I did my doctoral dissertation, maternal mortality, but with great focus in Nigeria. And that's why I asked that question.
That's a great question.
Yeah.
That's very, very good question. Yeah, go ahead.
Yeah, we do also work in that area, especially for women. Fortunately enough, women here in Malawi, they are open up. They have their groups. They do discuss. They are more open than men. So that's why when you look at the cases of suicide, it is the huge number is for men than women. But on issues of stress, anxiety, and other mental health issues, women are the ones who are affected. Many women are affected with mental health issues, but they are able to cope up because they do share their problems with their peer in the community, unlike men. But men, they do hide whatever it is happening on them, unlike women. I think that's where the problem comes in. But issues of childbearing, women maybe raising the kid from themselves, husband maybe run away, responsibility. Those are also some of the key issues happening to women. And like I say, fortunately enough, women, they are very open. They will maybe come to our organization. They will we'll make them to start village bank, what we call village bank. They contribute money and they share it maybe after 6 months. Then we train them on the businesses. They can able to start businesses, small businesses, and their life it goes well than men. So that's what I can say about men and women, especially in the community here in Malawi.
Thank you so much.
Any question? Any additional question or comments? And Anderson, and also, by the
Hello.
way, you are not on camera. Go ahead.
Hello. This is Rosemond.
Go ahead, please.
Thank you, Henderson. Thank you
Can
for
you turn your camera on if you can, please?
where I am. I don't think
Okay, that's
I
okay.
can.
Go ahead.
But, yeah, my apologies. My apologies.
That's
Yeah.
okay.
Yeah. Yeah. I like the presentation. Very informative, and yeah. Listening to you confirms for me actually that country-specific research is needed. I had actually published an article that I titled Placing Mental Health at the Center of Global Health Discourse and Agendas. It was a systematic review of global trends in adolescent suicide in the last decade. Being a university professor and teaching psychiatry and the law, my interest in mental health actually deepened. And I was looking at mental health as the center of health, placing it at the center of health. And what does that mean? It became very clear to me that the relationship is actually bi-directional. The relationship between mental health and health. Mental health and all that mental health, positive mental health and negative mental health, particularly negative mental health. If we want to deal with it and address it, then we need country-specific information that will enable us to do so and effectively. In this context, I just want to encourage Anderson that there'll be need for you to engage. I don't know who you are going to do that with, but stakeholders that share your vision for you to be able to advocate seriously to repeal that law. You talked about that penal law, the penal code, and I think that is going to work negatively. It's going to affect your work. It's going to affect the environment. I mean, if people are not going to be able to feel free and they will have to be arrested because they have tendencies to commit suicide, I think that is a negative. It's a negative environment, and you need to do that to ensure that that law gets repealed. Stigma is central. You realize that most people are very ignorant about mental health issues, negative mental health, and how that affects their lives and their health. You know, I, yeah, I have a psychiatrist doctor who tells me that we all have mental health issues, just the levels that differ. And so we are all affected. We are all affected, and the levels just differ. And so if we are able to create this awareness, that will go a long way. In our country, when I looked at placing mental health globally at the center of health, there weren't notable differences so much regionally, globally. And so the issue is big. The issue is big, but how we approach it is what is important. And that's why, for me, I think the country-specific research and data is very important. I'm learning a lot today, looking at culture and suicide. And the issue of economics also came in somewhere along the line when Anderson was presenting his paper to us, and the intervention. These interventions, I like it. The fact that it's local, the fact that you are harnessing local resources. And I would want to encourage you to look again at the hierarchy of health. You mentioned counselors. They are key. There are several stakeholders in there in our local environment that we can use. The only thing is that they have to be trained, and you need money for that. We need to train them to at least acquire basic knowledge and basic competencies that they can use to support, even if it means house to house. And then once you are in that vicinity, you are in that locality, and there is evidence that it works, the counselors are there. Even if there are pastors there who can be of help, you need to train them. Because sometimes the pastors and those who are ready to be of help, they have no expertise. Unfortunately, they don't. And they must be made aware that they need some kind of expertise to be able to help. And the shortage of human resources and expertise it's not unique to Malawi. I'm in Botswana, and when I'm teaching my students, it's the same thing. We have in total only 12 psychiatrists in the whole country, Botswana. And we also have one hospital that you can call mental health hospital. But of course, for us, all the tertiary hospitals at least have nurses that are trained in psychiatry. And so when the first level counselors are not able to be of help, they are able to refer to the tertiary level of care. So that helps. But honestly, the issue is big. And the connection between poor mental health and suicide is clear. The correlation is there. And so we need to do something, and something quickly. And I think from listening to Henderson, it confirms for me that the local approach is the best way to go. Thank you very much. My work is actually available. It's published. So if anyone wants to...
Please, Rosamond, can you share your article on the chat? Can you put it down, or the link or whatever? But I have to say,
Okay.
you know what? Thank you so much for actually joining us, because you nailed that nail on the right place. The right place is that the basis of, can you guys hear me?
Yeah, we can hear you.
Okay. Yeah. The basis of public health, the foundation is mental health. And like I said, this mental health is underdiagnosed. Thank you for reminding us that we all have mental health issues, the level differs, right? So it's always important for us to recognize that. Everything you said is very, very fundamental, and that's where all my question cues into cultural integrity, cultural aspect. Definitely, we need as Africans to stop begging for information, begging for research. We need to start doing the research. Like you said, Rosemont, it has to be community targeted, community based, country specific, because most of the research you have to do, you need to realize that the environment affects human behavior, right? So we can actually start finding solutions to African problems. And the only way we can find solution for African specific problems is to do as African or country specific research to be able to find that information. And thank you so much for all that information. You are absolutely 1000% correct. Thank you.
Yeah, I wanted also to comment on what my fellow colleague from, is it Botswana?
Yes.
Yeah. Mm-hmm.
Yeah, that mental health is for everyone. Everyone is actually a potential patient of mental health. And I think I remember last time when we were advocating for decriminalization in 2020, was an incident where the minister commit suicide right away in the parliament. He shot himself with a gun here in Malawi. And it was a very serious case. That's when people understood that mental health can affect everyone. Everyone can be a potential patient of mental health. And we need to look for each other. And we need to create an environment where people can able to express themselves and share information to each other. So I wanted to comment on that fact.
Okay. Mm-hmm.
Thank you,
Yeah.
Rosemont.
May I say something, please?
Go ahead,
This is,
Dr. Nanambo.
this is Amanambo. Thank you very much, Mr. Hedison, for your presentation. I really enjoyed it. I gathered a lot of information about Malawi. My only concern, or what I would like to know more, is the, I can't pronounce it, but I'll try to pronounce it. It's called the Kikamiri type of marriage.
Yeah.
Yeah, where the husband has to move into the wife's family. I think that's will be a very stressful type of environment. And
Yeah.
it is, yeah, there's a
No, I'm not laughing as
based on
a
what you
mockery,
describe,
but
where at times they get you to kick you out after you have built your house and things like that. Does the government do anything about that type of marriage to be able to reduce the incidence of the wife divorcing the husband and taking over the family property?
There's no much I think the government is doing, because it's based on the cultural laws. So, for example, when you want to marry, you choose. It's either you go for those type of marriage, you go for Christian marriage, you go for statutory marriage. So statutory marriage is the one which is regulated by government, while the cultural marriage are based on the cultural laws. So you have to be abided with those cultural laws. So that's why it becomes also a problem for government maybe to regulate some of the cultural marriage laws. They just follow the formality. You did a patrilineal marriage. What are the formality? What are some of the things they follow in the patrilineal marriage? So when you want to divorce, they will check on those issues. So the judgment will be based on those principles. While on statutory marriage, that's when government has all the powers, because you go to legislate with the government.
Okay, thank you very much. In this case, what would be a very good type of intervention into this type of community to inform them about suicide and the tendency of reducing that incident of suicide in that community?
Yeah, I think that's what we have already started, engaging the chiefs, because they are the ones who can able to influence a cultural change. So on the dialogue, we invite all the opinion leaders in the community, at least to change some of the harmful cultural practices, which affect also people and prompt the negative mental health. So we are trying to engage the chiefs, and also we are trying to train men so that they can able to open up to their fellow men, to share information, so that whenever there's something happening, they are able to at least present themselves, whether to the chief's court and also other relevant authority within the community, so that they can able to be assisted.
Yeah, thank you very much for the information.
And one take home on this is that there's no type of marriage that is perfect. I think we all can agree on that. But also, what is important is for what they are doing right now, engaging in community and identifying all the areas where people take advantage of certain things and advocate for a little bit change, to be able to, reduce the gap through which people take advantage. Even here in the US, marriage law is not perfect in the US. We know what happens here in the US with the marriage laws, and we know how people lose all their stuff. But at the end of the day, I think culture is not static. It changes, it moves. Our role in this generation is to identify the cultural practices and identify the areas that are bad that we need to move away from and modify it and make sure that it's safe for everybody, both men and women. So we cannot always be living in an environment to favor one or the other. We have to know that mental health affects both men and women. It affects even children, right? So in a marriage situation where divorce happen and there's already children involved, the study shows that children with both parents do well in academics, right? So we need to promote nuclear family, a safe nuclear family, and then move on from there. I mean, it will never be perfect. There's no way it's gonna be perfect. There's gonna be outliers, but we need to advocate is as long as the majority of the good aspect of any element in our society is within the bell curve shape. We can start working with the exceptional and intervene as needed. But overall, there should be constructive, proactive interventions to be able to mitigate some of the issue, specifically mental health. We should be working now, especially among younger people and in the community, to intervene and do what we have to do to be able to build a healthier society. I will leave it there. If there's no other questions, I will just close this session. This is a great session. And by the way, Henderson will be coming back in October to present on, I think, is sexual reproductive health rights. So he will be coming to present that information as well. But if there's no other further question, thank you, everyone. I appreciate you spending almost 2 hours in here with us and interacting on this important topic. And if you already subscribed to our YouTube channel, you will get an alert And then please, if you get it, send it to all your colleagues so that those that didn't have opportunity to attend, so that they can actually have the opportunity to get this information. I really appreciate everybody. Thank you so much and have a wonderful day.
Thank you.
Thank you.
Thank you very much, Messi. Thank you.
Thank you.